In a significant move, Health Secretary Robert F. Kennedy Jr. has dismissed all 17 members of a U.S. Centers for Disease Control and Prevention panel of vaccine experts and is in the process of appointing new members. This decision has sparked protests from numerous vaccine scientists. Kennedy, who has been a long-time skeptic of vaccines, aims to reshape U.S. regulation of vaccines, food, and medicine. While Kennedy believes that these changes will restore public trust, many scientists and experts argue that altering the vaccine panel could undermine public confidence in health agencies. Kennedy stated, "Today we are prioritizing the restoration of public trust above any specific pro- or anti-vaccine agenda." Despite his history of questioning vaccine safety and efficacy, Kennedy pledged to uphold the country's existing vaccine standards to secure his role in President Donald Trump's administration. During Kennedy's tenure, the Food and Drug Administration has approved several vaccines, despite concerns about his views. However, at least one senior Republican member of Congress has expressed doubts about the changes to the panel. Kennedy criticized the Advisory Committee on Immunization Practices for being filled with conflicts of interest, and claimed it has never rejected a vaccine. Although the decision to approve vaccines lies with the U.S. Food and Drug Administration, the CDC panel provides guidance on which groups would benefit most from an approved vaccine. Former FDA chief scientist Jesse Goodman commented, "This is a highly professional group of scientists and physicians. It's the kind of political meddling that will reduce confidence rather than increase confidence." Following the announcement, shares of vaccine makers Moderna and U.S.-listed shares of BioNTech fell by more than 1%, while Pfizer's shares saw a marginal decline in extended trading. Kennedy alleged that most panel members receive funding from drug manufacturers. However, members are required to declare any potential or perceived conflicts of interest during their tenure and disclose relevant business interests or connections with organizations pertinent to the committee's work. The Department of Health and Human Services and Kennedy did not provide specific evidence of industry conflicts among departing ACIP members. According to the CDC's web page for conflicts of interest, updated in March, one member had recused herself from votes on certain vaccines due to her involvement in clinical trials for their manufacturers. All 17 ACIP members were appointed under former President Joe Biden's administration, including 13 in 2024. Without their removal, Trump's administration would not have been able to appoint a majority until 2028. Dorit Reyes, a vaccine law expert at UC Law San Francisco, noted, "This is not a political committee. It's never been partisan. It's an expert committee. Presidents have never been involved in ACIP membership." The decision has drawn criticism from Democrats in Congress, and one key Republican has expressed concern. Republican U.S. Senator Bill Cassidy remarked that there is fear the ACIP will be filled with individuals who lack vaccine knowledge, except for suspicion. He assured he would continue discussions with Secretary Kennedy to prevent this outcome. Cassidy, a doctor from Louisiana who had reservations about Kennedy's anti-vaccine views before supporting his appointment as the nation's top health official, stated he received assurances that Kennedy would protect existing vaccination programs. The CDC panel is scheduled to meet next on June 25 to 27 at CDC headquarters in Atlanta. Vetting new panel members typically takes months, according to an expert close to the committee who doubted the newly appointed panel could meet on time unless Kennedy and his team had been preparing them months in advance. Kennedy has faced criticism from health officials for his vaccine policies, including what they describe as a weak endorsement of measles vaccinations during an outbreak that infected over 1,000 mostly unvaccinated individuals and resulted in 3 deaths. Last month, he announced that the government was dropping its recommendation for healthy children and pregnant women to receive COVID shots, bypassing the typical process. Traditionally, once the FDA approves vaccines for public sale, ACIP reviews data in a public meeting and votes on vaccine recommendations, which are then sent to the CDC director for approval. The Affordable Care Act generally requires insurers to cover vaccines listed on the CDC vaccine schedules for adults and children. The recommendations also determine which vaccines the CDC's Vaccines for Children program will provide free of charge to those without insurance.